And world leaders, philanthropists, and health experts are urging President Trump to reconsider his decision to temporarily stop payments to the World Health Organization. President Trump is ordering his administration to investigate the WHO's handling of the coronavirus pandemic. Tonight, the American Medical Association is calling that move a dangerous step in the wrong direction. Joining us tonight is the president of the American Medical Association, Dr. Patrice Harris. Welcome to the show, Dr. Harris.
Thank you for having me.
We wanted to speak with you about the World Health Organization, but in light of the fact that we have just received these guidelines on reopening the country, I'd like to get your interpretation of what you're hearing.
Well, certainly I look forward to doing a deeper dive and learning more about the details, but I can tell you that a phased-in approach seems reasonable. But the most important piece of returning the economy back to some sense of normalcy or loosening the restrictions is an approach based on data and the science. And we know now that we really have incomplete data. We may know the number of deaths, we may know the number of hospitalizations, but we don't know the total number of those tested. And we also need to see the data based on race and ethnicity. So it seems a reasonable approach, but we certainly always have to keep in mind that we have to follow the data. And each region will be different. We know there continues to be increasing numbers of deaths in certain parts of the country. And so there has to be some flexibility there, and each region should be on their own timeline.
And you're actually in Atlanta, Georgia, is that correct?
That is correct.
So you agree with the fact that different parts of the country are okay with staggered openings?
Well, certainly if these openings are based on the science and the data, certainly governors are working with their state and local public health officials and have the data on the ground. So it certainly makes sense for a regional approach. We see in New York that New York is working with the states surrounding New York to make these decisions. So as long as science and the data and the evidence are guiding these decisions, that's certainly the right way to go.
So, Dr. Harris, talking about the data, let's switch back now to the World Health Organization, because they obviously would be responsible for providing some of that worldwide data. Is that correct?
Yes, the World Health Organization has been a wonderful partner in global health, working with the CDC here and certainly other health officials in countries around the world. A great partner when it comes to HIV and AIDS and polio. And so certainly we at the AMA believe that at this point in time, in the midst of this global pandemic, we should not be halting funding. The president should not halt funding to the World Health Organization. And we have urged him to reconsider that decision.
So this does, in fact, in your opinion, hinder the worldwide fight against the coronavirus and possibly extend the impact of places of the virus in the U.S. and even in sub-Saharan Africa.
Absolutely. You know, the virus knows no borders, and certainly an infectious disease outbreak anywhere could ultimately impact us here in this country. The World Health Organization serves as a technical advisor to developing countries that don't have the resources that we have here in the United States. So certainly if there are credible concerns, those can be addressed. But at this moment in time, in the midst of this global pandemic, we urge the president to reconsider halting funding of the World Health Organization.
So, Dr. Harris, tell me about your organization and tell me what you would like to see, what the opinion is of your organization, what really needs to be done right now to control what's happening.
So the American Medical Association is the largest professional organization representing physicians around this country. And just last week, I gave an address, a public address, urging us to always follow the science and the evidence. And that is everyone from our highest elected officials to those who are staying at home and social distancing, physical distancing, because that approach is an old-fashioned public health approach, and it works. We have been able to slow the spread of the coronavirus of COVID-19 because we are distancing from one another. So from the AMA standpoint, we are involved and engaged. We are listening to physicians across this country, voicing their concerns and certainly putting into action remedies and actions that address those concerns. But at the heart of our work, of course, as physicians, is our patients. And so our mission is to promote the art and science of medicine and the betterment of public health. And we are certainly actively engaged in this pandemic, and we are actively and will be actively engaged in all health issues when we get on the other side of this pandemic.
And Dr. Harris, we are so proud that to see you as an African-American woman, the head of this huge, important organization. We have to thank you and your colleagues for the fight that you are enduring against coronavirus. I would, however, like to ask you, as an African-American woman yourself, hearing that COVID-19 is affecting the African-American population much more than others, what is your take on that?
Yeah, those numbers were troubling, but unfortunately not surprising, especially when we learned early on that if you have high blood pressure or if you have diabetes, you were more at risk to getting some of the more severe complications of COVID-19 and unfortunately dying. So the issue of health inequities is not a new issue. At the AMA, we have been working on that issue. We just founded a new Center for Health Equity and our Health Equity Director, Dr. Aletha Maybank. So we have always known that this is a significant issue, and we will be there because when we get on the other side of this epidemic, we will have to make sure that addressing health inequities is a top priority. But for now, we have asked the HHS to make sure that they collect data based on race and ethnicity so we can then target interventions to the communities most in need.